HIV and AIDS in Nigeria has recorded commendable progress over the years, a key highlight at the 7th National Council on AIDS convened in Lagos.
We actually discuss, on how to sustain the response, despite the challenges we're having in terms of resourcing and sponsorship, to ensure that we take ownership of the response as government, both the federal government and the state government, and make sure that no one is left behind and that there is no break in service delivery, and we do not lose the gains that we have sustained or we have achieved over the years.
But this year's council comes at a pivotal time, just as the U.S. government slashes the USAID funding affecting global health initiatives, including those in Nigeria.
Reduction in funding, but it doesn't necessarily mean a significant reduction in the work that we do here in the country. The HIV program has benefited a lot over the past 20-25 years here in Nigeria, and we've done a lot of great things. And so it's a success story. Everybody is asking the question, how do we sustain it? But sustaining doesn't necessarily mean we have to perform at the same level of effort that we used to do before or need the same level of funding. And so it's a good conversation to have at this time. UNAIDS is still very much on ground. The UN programs are still very much on ground supporting. Whatever reduction will be, I think we'll make up for in the efficiency that we expect to get out of the way we work in Nigeria.
For Nigeria's National Agency for the Control of AIDS, NACA, and its partners, the funding reduction has prompted a strategic rethink. The message from the council: external support cannot be guaranteed forever.
When it happened with USAID, I said to some people it's really a wake-up call, and that what they're telling the rest of the world is that we should solve our problems. We cannot continue to depend on donors, but I believe that having realized that, the government is already doing what it has to do, and with further improvement, we should be able to get back fully on track.
The theme of this year's council, advancing the national HIV sustainability agenda in the changing global policy on AIDS.
Stakeholders agree the funding setback is also an opportunity, a wake-up call for Nigeria to increase domestic resource mobilization, build resilient systems, and ensure the gains made so far are not reversed. NACA insists its goal remains unchanged: to eliminate HIV and AIDS in Nigeria by 2030 with or without foreign aid. In Lagos for News Central, Bernard Akede.